Howdy, my name is Edward Little and I am going to introduce myself to you in this class. I'm going to be showing you how I got from this little, if I do say, adorable creature over here on the left, me of 45 years ago, to the me now, not quite so wrinkle-free, but I also have this lovely little creature who is my youngest daughter, approximately just a month or so old at that point. And how I got from where I started over here to where I am now with a family of my own. As I said, my name is Edward Little. I was born approximately 45 years ago and had a lovely parents in the military. My mother was a nurse, my father was a pilot, so I kind of combined both, becoming a flight nurse myself. So I was able to combine both my dad's love of flying, and my mother's love of nursing and care of patients. In between them, pretty normal childhood, went to high school, and after high school, like a lot of people, looking for something to do, not sure what my trajectory in life was going to be, and my mother, I think out of desperation now looking back at it, but at the time, suggested that I take an EMT or emergency medical technician basic class, which I did while working full-time and loved it. Absolutely fell in love with it. Got what they call the EMS bug. And so then while I was working as a gurney gopher or stretcher fetcher, as they used to refer to EMT basics, I ran into some paramedics, or paragods as we used to call them, and I thought, my goodness, I really want to be like them. I want to know what they know. They seem to know everything. And so then I interviewed and got accepted into a paramedic program, went there full time, got my paramedic, and came out of it realizing I did not know nearly what I wanted to. So I'd worked with a lot of nurses in the emergency departments during my clinical rotations also as a paramedic, and I thought, they seem to know what's going on. And then I had my first interaction with the flight crew as a paramedic, where I turned over my patient to them, and I thought that they were awesome. They came in on their helicopter, they whisked away my patient. They were only slightly rude to me, but that's okay at the time. That's how flight crews were, and I thought, my goodness, I want to be like them. So after much research and discussion with crew members, I was able to determine that I needed to go back to school and become a nurse. That was my best option to becoming a flight crew member. So I went to nursing school while working full-time, got my associate's degree, and then while working full-time as an associate's degree nurse, I also went right into and got my bachelor's degree, which I'm very, very glad I did for obvious reasons, especially now that you're basically required to have your bachelor's degree to even work in the hospitals. I then, from there, worked tirelessly to get my flight nurse, which is a lot of working in the ICU, in the emergency departments, getting your various experiences, pediatrics, OB, cardiac, trauma, neuro, you name it, jack of all trades, master of none. Somewhere in there I managed to meet a lovely woman who was willing to put up with my eccentricities, and we've been married for close to 19 years now, and have 3 lovely children. An 11-year-old boy, an 8-year-old boy, and a 4-year-old daughter, which is quite busy, as I've seen some of you with your families as well. And I am very lucky also in that my family has been very supportive of my adventures in higher education and my need to be in a helicopter or fixed wing or ambulance. Part of my career, I am part of Life Flight Network, which is the largest not-for-profit helicopter emergency medical services in the country. We transport all age groups from still in mama's belly to over 100 years old and everything in between. Some of my prouder moments have been doing ECMO transports, or LVAD, or Impella transports. I've done 2 surgical crikes in the field, multiple chest tubes, blood administrations, and even maybe saved a life or 2 now and then. More importantly, though, I'm feeling that it's about ready for me to make the next step in my career. An educator such as myself at any other hospital or large organization would at least have their master's degree, and I feel that that is important to the evolution of not just flight nursing but nursing in general, that we do everything we can to increase our knowledge so that I can pass this along to the next generation. Having said that, I am looking forward to seeing the rest of your presentations. I've also enjoyed the marvelous amount of experience and life views that I've already witnessed from my classmates, and I'm looking forward to more of that, and just looking forward to see what the future brings. And I feel very lucky that I'll get to hopefully experience that with the rest of you. Thank you very much, and have a great day.